Most people believe a heart attack always starts with severe chest pain, collapsing to the ground, and an emergency ambulance rushing in. But the truth is far more dangerous. Many heart attacks are silent. They cause little pain, no dramatic symptoms, and no clear warning. Millions of people suffer heart attacks and never realize it. They continue living their daily life until weeks, months, or even years later, when serious heart damage is discovered. In this video, you will learn what a silent heart attack really is, why it is more common than you think, the early signs most people ignore, who is at highest risk, and what you can do to protect yourself and your family. This video could save your life or the life of someone you love. What is a silent heart attack? A silent heart attack, also called a silent myocardial infarction, happens when blood flow to the heart is blocked, but the symptoms are mild, unusual, or mistaken for something else. The heart muscle is damaged, just like in a regular heart attack, but the warning signs are not obvious. There may be no chest pain, or only slight discomfort. Some people feel tired, short of breath, or unwell for a few days. Others feel nothing at all. Doctors often discover silent heart attacks weeks or months later during routine tests, such as an ECG or heart scan. By then, permanent damage has already occurred. Why silent heart attacks are so dangerous? Silent heart attacks are dangerous because people do not seek help. They ignore the symptoms, thinking it is stress, fatigue, acid reflux, or aging. Without treatment, the damaged heart muscle becomes weaker. This increases the risk of heart failure, irregular heartbeat, stroke, sudden cardiac death. Studies show that people who experience silent heart attacks have the same risk of death as those who have classic heart attacks. The only difference is awareness, and awareness saves lives. Who is most at risk? Anyone can experience a silent heart attack, but some groups are at much higher risk. First, people over age 40. As we age, blood vessels become stiffer, and plaque builds up in arteries. Second, people with diabetes. Diabetes damages nerves, which can reduce pain sensation. This means heart attack pain may not be felt clearly. Third, people with high blood pressure. High blood pressure damages artery walls and accelerates plaque buildup. Fourth, people with high cholesterol. Excess cholesterol narrows arteries and increases blockage risk. Fifth, smokers and former smokers. Smoking damages blood vessels and reduces oxygen supply. Finally, people under chronic stress. Stress increases inflammation, blood pressure, and heart strain. Many people fall into more than one category, which multiplies the risk. Early warning signs most people ignore. Silent heart attacks rarely announce themselves loudly. Instead, they whisper. Here are the most common warning signs. Unusual fatigue, feeling exhausted, even after resting. Simple activities feel difficult. Walking short distances causes tiredness. This fatigue may last for days or weeks. Many people ignore it, thinking they need more sleep. Shortness of breath, difficulty breathing while resting or doing light activity. Feeling winded without exertion. This happens because the heart cannot pump blood efficiently, often mistaken for aging or being out of shape. Jaw, neck, or back pain. Pain or pressure in the jaw, neck, shoulders, or upper back. This pain may come and go. It is often mistaken for muscle strain or poor posture. Nausea or indigestion. Upset stomach, nausea, or mild vomiting. Some people believe it is food poisoning or acid reflux. In reality, the heart and stomach share nerve pathways. Cold sweats or dizziness. Sudden sweating without heat or exercise. Lightheadedness or feeling faint. This can indicate reduced blood flow to the brain. General discomfort. A strange feeling that something is wrong. Pressure, tightness, or discomfort without pain. Many people describe it as uneasy. This instinct should never be ignored. Why the brain misinterprets these signs? The human brain looks for familiar patterns. When symptoms do not match what we expect from a heart attack, we dismiss them. Movies and media have trained us to expect dramatic chest pain. But real life is different. Silent heart attacks often trigger the brain to choose the least dangerous explanation. Unexplained anxiety or sense of doom. Some people experience sudden anxiety without an emotional cause. A feeling of panic, fear, or impending doom. This reaction occurs because the heart is not receiving enough oxygen. The body senses danger before the mind understands it. Many people mistake this for a panic attack. Sudden sleep disturbances. Difficulty sleeping without reason. Waking up suddenly during the night, often with mild discomfort or breathlessness. Nighttime heart stress can trigger silent symptoms. Poor sleep is often the first clue that something is wrong. Unusual cold sensitivity. Feeling unusually cold, especially in hands and feet. This happens because blood circulation is reduced. The body prioritizes vital organs, reducing flow to the extremities. Weakness in arms or legs. A sudden feeling of heaviness or weakness. Simple movements feel difficult. This can occur when blood flow is temporarily reduced. Many people think they are just tired. Headache or pressure in the head. A dull headache or pressure feeling. Reduced blood flow can affect oxygen delivery to the brain. This symptom is often ignored, especially in people with high blood pressure. Light nausea after physical activity. Feeling slightly sick after light activity or walking. This is a warning sign that the heart is struggling. Many people blame digestion, but the cause may be cardiac. Frequent sighing or deep breathing. Taking deep breaths often without realizing it. The body attempts to increase oxygen intake. This subtle sign often goes unnoticed. This is a survival instinct, but in this case, it can be fatal. How silent heart attacks are diagnosed. Silent heart attacks are usually discovered during medical tests. Doctors may find abnormal ECG readings, heart muscle scarring on imaging, reduced heart function, irregular heart rhythm. Many patients are shocked when told they had a heart attack without knowing it. Early diagnosis can prevent further damage. How to protect yourself. The good news is, most silent heart attacks are preventable. Here are simple steps that save lives. Get regular heart checkups after age 40. Monitor blood pressure and cholesterol. Control blood sugar levels. Avoid smoking. Manage stress daily. Stay physically active. Eat a heart-healthy diet. Never ignore unusual symptoms. If something feels wrong, trust your instincts. Getting checked early is always better than waiting. Final message. Your heart does not always scream for help. Sometimes, it whispers. Listening to those whispers can save your life. If you found this video helpful, subscribe for more life-saving health content. Share this video